Well, it's time to bring in our good friend, Dr. Joe Congini from Sports Medicine Center at Akron Children's Hospital. Joe, good morning, my friend. Thanks for getting in touch again this morning. And what do you have on the table for all of us this morning?
Well, Ray, when you've been around a while, you kind of start to see patterns develop. And this is the time of year in the sport medicine clinics around, and especially at ours, where we get into what we call training injuries, or really overtraining injuries. And that's the pattern that we see in the months of June and July. We have a lot of rising juniors and seniors that want to have their best year and they want to get ready in the summer. We have a lot of kids going to college and it's a jump up in level. We have a lot of 20-year-old kids who just want to be in the best shape in their life. And so they get into the weight room and they do some traditional lifting like squatting and overhead lifts, or they do the high-intensity interval trainings, the different fit programs and Orange Theory and other things. They do explosive training for certain sports if they're in soccer, basketball, football, or they do endurance training. They're runners and they swimmers and they want to really increase their mileage. And so everybody's pushing the envelope, and some tissue begins to break when they overload this. And sometimes it's the bone, and we've talked about stress fractures here a lot. But the other tissue that by far and away we see this time of year are really significant injuries to the tendons. And a lot of kids just can't think, oh my gosh, could I be struggling this much with a tendon injury? And yes, they can. So remember, everybody out there in Ray's audience, the tendon is a good big shock absorber that connects muscle to bone. And it really absorbs a lot of shock and also gives us a lot of explosion when we're doing sporting activities. But when we overload that tendon unit, it starts to get micro tearing, and it becomes painful, and it swells a bit. And after it's been swollen for 2, 3, 4 weeks or a month or more, it starts to try to heal with scar tissue. And when it has scar tissue in it, the tendon isn't as effective as a shock absorber. And it's like a downhill pattern. So these kids say, well, yeah, 2 or 3 months ago I started to be achy. Now I can't even lift my arm. I can't even run at all. I have to get on a bike because I can't train at all. And they're very frustrated. So the three major locations where I see these tendon problems this time of year, Ray. Number one, the patellar tendon. That's around the kneecap. The one below the kneecap particularly, but the one above it, the quad tendon, I see a lot too. And these kids, oh my gosh, when it's starting to get to be more and more of a problem, they can't run, they can't jump, they can't train with their team. And these athletes are 2 months away from the start of their season. They're very distraught when they get into our office, very concerned as the calendar's running out on them. In the upper extremity, a lot of times the tendon is the big rotator cuff. And when they're doing overhead activities, and especially lifting overhead, they begin to get scar tissue in the rotator cuff, and they can't even lift their arm when this gets to be bad. So you can imagine tennis players and pitchers, and they can't lift their arm. And the third tendon is the Achilles. This is one of the most explosive but also shock-absorbing tendons in the body, of course, in the back of the calf connecting to the heel bone. And they just start losing mileage. They can't run, and half their mileage, a third of their mileage, and then they're having to cross-train totally on a bike or a pool, and they're very upset. They're months away from competition. But when we get to see them early, we can get these people better. So the strong recommendation is don't wait too long. Get in early when you have these injuries. We get started on aggressive sports rehab, and so we alter their training programs, which allows these tendons to heal. We do deep tissue treatment, and deep tissue treatment even with tools called Grafton tools. And we do stim and dry needling. And if they're close to competition, sometimes bracing can help with that overload a little bit. Or nowadays, a lot of different types of taping, like the kinesio taping, can help. But we're still in the middle of summer, and if we get these kids now, we have a really good chance of having them ready by early August, mid-August, certainly by the 1st of September. But don't wait too long. If you come in our place on on August 15th and you say, I got to be ready for the fall season, there's not going to be enough time to get that turned around. So these training injuries, if you're getting them right now, now's a really good time here at the end of June and July to get them taken care of.
All right. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Joe, always my friend. Thank you for the time and the visit, and we'll get back together next Wednesday morning. Always appreciate the time, my friend.
Enjoy this glorious weather, Ray. Okay, have a great week.
You are exactly right, Joe. Dr. Joe Congini, Akron Children's Hospital, Sports Medicine Centers.